Hello, my name is Blair Starling, and I'm a student researcher here at Meredith College in the Department of Psychology and Social Work. This year, I've been working on my research and my honors thesis titled Effect of iPad Intervention on Nonverbal Communication in a Preschool Child with Autism. During this process, my faculty advisor was Dr. Dorian Fairbank. First, I want to give you an overview on the autism spectrum disorder. 1 in 59 children in the US have autism. Autism is also more prevalent in boys. Autism is a spectrum disorder, and what this means is that not everybody with autism are exactly the same. They don't have the same symptoms. They may have different challenges, different difficulties, and different strengths. One person could be high functioning, one could be low, and just in general, you can't classify all people with autism as exactly the same. They're under an umbrella, a spectrum. But they all share similar difficulties with communication and social interactions. And what this can look like is someone may not use verbal communication. They may have issues forming sentences. They may choose just not to speak at all because they don't prefer it. This also can have social interaction difficulties with that. This may look like they may not understand what you're saying at times. They might not pick up on verbal, physical, or general gestures at all. They also may have difficulties just socializing and understanding other people's emotions and making friendships. They also have difficulties with repetitive or maladaptive behavior. And what repetitive behavior can kind of look like is someone may need to flick on the light switch every time they enter in a room and flick it on and off. Or a child may have to line up their toys in an exact order before they can play with them. And maladaptive behavior could look like someone has to repeatedly hit themselves in the head when they're upset, or they scream really loud when they're upset. They could also bite themselves or other stuff like that. Currently, there's no cure for autism, but it can be treated with therapy and medication. And there are many different types of therapy that are out there for people with autism. The one I'm most common with is ABA therapy, which is therapy that's used at the Meredith Autism program, which is where I did my research and have worked there since I was a freshman in college. Also, there's cognitive therapy, there's speech therapy, and occupational therapy, and many other therapies that could help someone with autism. Also, this is more of a public service announcement. When you talk about anybody with a disorder or a disability, you should use person-first language. So as you've noticed, I haven't been saying autistic people or an autistic person or an autistic child. And that's because you should always put a person first before their disability. It's just a way to show that you care as them as a person, it's integrity, and just really showing them that you care about them before their disability. And it's not just with people with autism. You should also do this with other patients. Like, you shouldn't say a diabetic patient, you should say a patient with diabetes. So public service announcement, please always use person-first language. Moving on, I'm going to go into some past research that helped me develop my research. First, I looked at Guevara et al., and what they looked at was 3 different types of applications and displays available on iPads for alternative communication. And what alternative communication is a way to communicate without necessarily having to speak or use your voice. Many people see this kind of as pictures or sign language, or you may type something out and then have your phone or your iPad speak it for you. That's all forms of alternative communication. And what he found was that the best alternative communication for children with autism were ones that had widgets in their iPads, had the word and the picture of what they're trying to say. And when the person clicked on it, it also said the noise, like the phonic for it. So an example of this is if a child needed their phone and they had their iPad, they would press an icon that had a picture of an iPad, a picture of a phone on it, the word phone on it, and the iPad would say phone when the child clicked it. And he found that this really increased the understanding of language for children with autism. The second one I looked at was Lee et al., and she looked at iPad intervention versus therapist intervention for 2 male children with autism. So what she really focused on was trying to see why they liked iPad intervention more, but it was still very unclear. But she did find that iPad intervention increase on-task behavior and correct responses in children with autism. And she actually found that one of her participants 100% of the time preferred iPad intervention over therapist intervention. The last person I wanted to talk about today was Mercury. She examined reaction rates for children with autism on 3 different devices to see which was the most motivational for participants. So what she looked at was iPads, PECs, which is picture cards. So the person would have a picture card and hand it to the person they're trying to ask for something. And then a high-tech communication technology. And she found that iPad intervention would increase more independent demands among participants. And this research is really what I based my current research off of. I looked at reaction rates, and she also used Proloquo to Go, which is the app I use in my experiment. So the purpose of my specific study was to conduct an ABA experiment on a child with autism who is nonverbal and determine if natural gestures or iPad intervention improved motivation for manding. So I'm going to break that down for you. What I was looking at is I was trying to see if natural gestures that the child already knew or if iPad intervention would motivate the child more to respond or mand for something. And what manding means is asking for something. You would ask for like a cup of water. That's a mand. So I'm trying to see which one would motivate a child to mand or request for things more often. My hypothesis was that iPad intervention would decrease reaction times for manding, meaning iPad intervention is more motivational. So I'm trying to see if there's a decrease in the amount of time that it would take for a child with autism to respond and ask for something, and if an iPad would be more motivational and decrease that amount of time. So my participant in my study was a 3-year-old male with autism. He was nonverbal, and the experiment was completely voluntary. His parents signed consent forms, and I gained assent from the child and explained the entire research to him in age-appropriate terms. Also, during the experiment, if he ever showed signs of distress, such as crying or swatting, I ended the experiment immediately. It was also all confidential. All tables and charts and data that was collected was destroyed. And all the Meredith Autism program also records all of their sessions with their clients, but all of those are destroyed 7 days after recording. The child was also not compensated, but he was highly thanked and his parents were highly thanked for participating, and the child may have benefited with his verbal communication and nonverbal communication from this study. And participants were treated in accordance with the ethical principles of psychologists and code of conduct from the APA. First, I'm going to go over some materials with you. So the first thing I conducted in my experiment was a free operant preference assessment. And why I did this was I was trying to find something very motivational for the participant to demand for or request for. For this, I needed a stopwatch, a paper for recording, a pencil, a letter book, toy keys, Elmo ring, foam number puzzle, small plastic animals, and a light-up dinosaur. And these 6 toys right here are what I was trying to see were motivational for him and what he preferred. In my ABA experiment, I needed a stopwatch, a paper for recording, pencil, paper to serve as a neutral stimulus, an iPad with the Proloquo to Go app on it, small plastic animals, and a foam number puzzle. So my overall procedure, it was first approved by the Departmental Review Board at Meredith College, and then it was approved by a board-certified behavioral analyst, or a BCBA, at the Meredith Autism Program. And then I also got informed consent forms signed by the participant's legal guardians, and then the participant was informed using appropriate language. And then I conducted my free operant preference assessment, and then I conducted my actual experiment, and then the legal guardians and the participants were debriefed. So first, I had my free operant preference assessment procedure, and like I said before, I did this to find what was very motivational, what toy would really motivate my participant to actually participate in the experiment, and really would get the participant to respond and feel the need to mand for that item. How this worked was the participant was placed in front of 6 toys, and there was no other items in the room, or they were all covered or all removed. And he was given free range for 5 minutes to play with the toys however he deemed necessary. During that time, I was recording how long he played with each individual toy, and then the top 2 toys were utilized in the experiment, so he would be more motivated to participate in MAND. So these are the free operant preference assessment toys I used. I talked to his BCPA to find out what type of toys he was really into, and that's why I used these. I used an Elmo ring, a small plastic animals, a foam puzzle, an ABC book, plastic keys, and a light-up dinosaur. And after the preference assessment, it was determined that the small plastic animals was the #1 motivational toy, and the foam puzzle was the second one. So my procedure for the experiment went over 16 days, and every day I conducted 3 trials. The first section of my study was baseline 1, where I looked for natural gestures, and what I would do is I would put the child in front of the 2 items and a neutral stimulus, which is the white piece of paper, and I would see if he would reach for one or point for one or try to grab one. And when he did this, I rewarded him with the item that he was requesting for. And the purpose of the neutral stimulus was to see if he was actually requesting for what he wanted and not just giving me anything just to be out of the experiment. So that was for 4 days and 3 trials per day. The next one was treatment 1, and it was the exact same setup as baseline 1 with the 3 items, the neutral stimulus, and the 2 motivational items. But the child was given an iPad to respond what he wanted. So the second that his finger touched the iPad, that is when it would demand for it, and I would reward him with that item. Baseline 2 was the exact same as baseline 1, and treatment 2 was the exact same as treatment 1. And why I did this was I removed the treatment to see if it was actually the treatment that made the difference, not any other co-founding variable. And how I measured the reaction times throughout this was the exact moment that I ended asking, "What do you want?" and presenting him in front of the toys, and the amount of time that it took him to respond either with natural gestures or using the iPad, that was the reaction time, the duration. And I wanted these to be low to show that he was very motivated to mand for that item. So my results, here are all the means and the standard deviations for each section of my experiment. And as you can see, the lowest mean was for treatment 2, and then the second lowest mean was for treatment 1. So this really shows that iPad intervention really decreased the reaction time for this participant, and he was motivated to use the iPad more than natural gestures. And the reason why I was looking at this is because people with autism usually don't like using gestures, don't like using one-on-one communication. So he was opting out using more natural gestures with the person for an iPad. This also really was shown because the lowest mean reaction time was in baseline 2. And baseline 1. And reaction times overall decreased with iPad intervention. And also, because I removed the treatment in baseline 2 and then re-added it in treatment 2, it really showed that the iPad was making the difference and not any other random variables that could have occurred to cause that difference. So this is my table for my free operant preference assessment, and it breaks down all of the times that the child played with each item. And as you can see, small plastic animals and the foam puzzle were the highest. And then this is the means and standard deviations of each baseline and treatment. And then this is my figure 1, which is my ABA graph. And then this just really gives you a more physical representation of how it went. So as you can see in baseline 1, the dots were all over the place. He was sometimes responding kind of quickly, sometimes he wouldn't respond at all. And then I added the iPad and it was very concise. The dots were much more together and he was more consistent. And then the same thing happened in baseline 2 as baseline 1 and treatment 2 as treatment 1. So discussion overall, these trends suggest that iPad interventions decreased reaction times for manding in a child with autism that has no verbal communication. The means of each baseline and each treatment supported that reaction rates were lower for iPad intervention. Furthermore, when treatment was removed, reaction times increased for baseline. And the present study also supported all the results from the past research that I looked at. And just the synopsis, this is that it really showed that iPad intervention could be a possible use for this child to help him mand more, to be more engaged, to use more communication in his life. So some limitations. First, I had a small sample, as all case studies are. It's one participant. You cannot say that this is going to work for every single person in the world because he's only one person and everybody's different. Also, the gender. He is male, and it shows that females with autism often have different difficulties. They're more just different in general, have different challenges. Also, individual differences. He likes iPad intervention, but another child might like PECS, and a different one might prefer sign language. It all depends on what they prefer. Also, autism is a very broad spectrum. This might not be an applicable device for someone that's on a lower spectrum than him, or someone on a higher spectrum might need something different. Also, it was only conducted on one man. Just because he was able to man for a toy for me does not mean that he could man for a food item. Doesn't mean that he could man to go to the bathroom. It has to be tested on more than one man to really say that it works for him. So some future research. First, we need some multiple participants. I would suggest multiple baselines across participants. Also multiple types of mands and multiple baselines across behaviors. So you can get more mands in there, more people, more participants, more people on the high functioning scale for autism and on the low one to really see if this is really helpful. And then in conclusion, just an overall synopsis, manding reaction times for preferred toy items decreased for this 4-year-old participant with autism who lacks verbal communication. The ABA experiment suggests that the decrease may have been caused by iPad intervention. Therefore, iPad intervention may be an alternative form of communication for this child and possibly for others. And these are all of my references that I used throughout my research and my thesis. And before I log off, I just want to thank you for sitting here and listening to me. And I've really enjoyed this study. It's really touches my heart, and I just want to thank Dr. Dorian Fairbanks so much for helping me and guiding me through this, and thank you so much to the Psychology and Social Work Department to allow me to do this and the honors program. And thank you all for watching. Have a nice day.